Hello, dear students and esteemed learners. Welcome again to my course on Sociology of Health. This is lecture number 14, and today we are going to cover the topic social medicine, community medicine, and preventive medicine. And as you all know, that this is the third week of our course, and we are covering the broader theme medical pluralism and health behavior. So, in this week, we have covered topics like biomedicine, and then we talked about traditional medicine, alternative medicine, and complementary medicine. And then we discussed the different traditional medicines prevailing in India, known as Indian systems of medicine. Right? So, after talking about all those different systems of medicine, today we have included these names like social medicine, community medicine, and preventive medicine. Now, you may think that are these also different systems of medicine? Though, then I would like to say that no, these are not different systems of medicine. These are different formats of medicine. These are operating within the larger system of biomedicine, but there are certain new inclusions here and there. So these are new in terms of their format or in terms of their location. So very often students get confused with these terms that okay, what is social medicine and then what is community medicine and how these two systems are different from each other and several other questions, right? Sometimes people think that social medicine is like sociology of medicine. So we will try to address all these questions in this lecture. The concepts that I have covered are primarily these three and one more, which is the community health also. So what do we understand by social medicine? What do we understand by social medicine? Social medicine is recognized as one of the medical specialties in many countries of the world, including the European countries and the US. Now, medical specialties here suggest that social medicine is operating within the larger biomedical system, or it basically follows the approach of the biomedical perspective. And so these are primarily found in the medical systems or medical specialties. Some medical schools in the US have an academic department named social medicine or social medicine in combination with another discipline such as the Department of Global Health and Social Medicine at Harvard University Medical School, then the Department of Family and Social Medicine at the Albert Einstein College of Medicine, and the Department of Social Medicine at the University of North Carolina at Chapel Hill Medical School. So the names of this department suggest that the term social medicine is used frequently in the medical schools or medical colleges. And there are medical schools that have the Department of Preventive and Social Medicine in numerous countries, including New Zealand, Malaysia, Thailand, Myanmar, and India. That means in India also we have the departments like Preventive and Social Medicine. In India, we also have the departments like Community Medicine, and in our university also, in the medical college, we have a department like Community Medicine. So all these terms or all these departments within the biomedical system are existing as of now in the contemporary world. Now we will try to understand each of these and try to look at what kind of a difference is there with the other popular or prevailing forms. Little bit of things about the origin and definition of social medicine. In the 19th century, social medicine emerged as a movement to investigate medical problems in the light of social sciences and especially the social factors and determinants. You may remember while talking about emergence of sociology of health, we did talk about the developments which were taking place in 19th century in Europe, right? And in that lecture also we had referred the term social medicine. More than anyone else, it was French physician Jules Curin who introduced the term social medicine. And he urged his colleagues to help in creating a new society following the revolution of 1848. Now, there were several developments taking place in Europe that period of time. We are aware of the things which were happening in England, France, and Germany, right? So, there were issues like prevalence of epidemic, then disease, and we talked about these things in various lectures, right? And one of the responses of that situation was the coming into existence of the term social medicine. The idea of social medicine spread throughout Europe and England after the First World War. And now we know that after 1850s, so many things happened. And then we had the First World War in the beginning of the 20th century. And war basically creates altogether different kind of situation. There are issues like mortalities and morbidities and disabilities and several other situations like psychosocial conditions which were considered important at that point of time. So those conditions actually created the need of making biomedicine more inclusive and taking into consideration the psychosocial determinants and factors. Further, there were other things also. The Industrial Revolution and the subsequent increase in poverty and disease among workers raised concerns about the effect of social processes on the health of the poor. So, we have been talking about the issues related to illness and disease and how these get affected by the social factors or the environmental factors. So, there was a dominant perspective or point of view emerging which were basically making advocacy of taking into consideration the social aspects and the psychological aspects of health and illness within the dominant system of medicine which was emerging. According to Park, social medicine is not a new branch of medicine but somewhat an extension of the public health idea, reflecting the strong relationship between medicine and social sciences, or a new orientation of medicine to the changing needs of man and society. That means whatever things were happening in Europe in 1850s, some of those developments and trends were captured as public health. We'll talk about public health at length, but we have already stated that public health is actually a meeting point of the medical sciences and social sciences. So, very often students have a confusion that is social medicine similar to public health? And I have answered this question earlier also that social medicine primarily operates within the biomedical perspective, whereas public health is a combination of the biomedical perspective as well as the psychosocial determinants perspective, right? That means public health is somehow different from social medicine. Today we will cover the social medicine and other related things, and hopefully next week we will talk about public health at length. The field of social medicine seeks to understand how social and economic conditions impact health, disease, and the practice of medicine, and foster conditions in which this understanding can lead to a healthier society. Now, one thing is very important in this statement, and what is that? The practice of medicine. See, socio-economic conditions impact health and disease. But if we look it from the perspective of the practitioners, then these factors also play a very important role in the practice of the medicine itself. So it is not only affecting the people who are ill or sick, but it is also affecting the people who are basically the provider of the services. And so social medicine is trying to uh, include all these issues or dimensions. According to Path, social medicine is the study of a man as a social being in his total environment. Now, this total environment is very important, right? At that point of time, when it was emerging, it was considered as more inclusive than the more focused or more narrowly defined curative medicine as such, right? And that is why when we were talking about biomedicine, we talked about basically two trends within that. One was curative medicine and the other was social medicine. It is concerned with all the factors affecting the distribution of health and ill health in population, including the use of health services. Now, another important point which is emerging here is this, that it is talking about the health issues at the level of the population. That means at the larger level. On the one hand, curative health is talking about the health issues of people at the level of the individuals, whereas social medicine is talking about the health issues of the people at the level of the population. So this is a kind of inclusion here, and it is also talking about the kind of health services. That means whether the population is having access to the health services or not, or what kind of basically services people are having, right? That means social medicine is not only talking about or taking care of the curative medicine part, but also taking care of that curative medicine at the larger level, at the level of the population, and several other issues which are related to the health services. So that is the widening of the scope. Webster says that social medicine is medical science in relation to groups of human beings, right? So the focus here is on medical science and groups of human beings. These two terms basically give a required direction to this term. It is not merely or mainly concerned with the prevention and elimination of sickness, but is also concerned with the study of all social agencies which promote or impair the fullest realization of biologically and socially valuable human capacities. Now, you may notice the word promote or impair, because promotion of health is one dimension of thinking, and then identifying the factors which basically impair the fullest realization of the biological capacities, that is basically another direction. So social medicine is also focusing on the factors which somehow play role in impairment, right? So this is a larger perspective. It includes the application to problems of health and disease of sociological concepts and methods. So when it is getting widened, or when it is widening its scope, then it's including new concepts, and within the range of those new concepts come some of the sociological and anthropological concepts also. So this is how we can understand the concept of social medicine. Now we come to another important concept, that is community health. Now Mackenzie, Panger and Kotke, in their book An Introduction to Community Health, state that community health refers to the health status of a defined group of people and the actions and the conditions, both private and public, to promote, protect, and preserve their health. Now, here the focus is on the community. The word community is very important, and in sociology, we generally talk about community, and community refers to a group of people living in one specific area, right? So there is some kind of context related to the area where people are living. In our day to day uses, we talk about people living in rural areas and urban areas, and we identify often those categories of people as rural community and urban community, right? So when we talk about community, there is a kind of understanding about the area where these people are living. And if you look at it at the global level or at the regional level, then you can associate this with the place where the people are actually living. So that way we can talk about, or we can make use of the word community. And another important factor in the term community is the kind of association that people have, right? In sociology, we talk about basically some type of primary relationship and secondary relationship. The primary relationship are basically the close relationship, right? Some kind of emotional kind of relationship. So community is often considered to have that type of primary relationship. So use of the word community is very important here. And I thought that, okay, you need to have some kind of understanding about the word community also. So now this community health is looking at health from the perspective of the community. So community health refers to the health status of a defined group of people who are living in a specific area, or which is defined on the basis of certain other category also. And the actions and conditions, both private and public, to promote, protect, and preserve their health. For example, the health status of the people of Muncie, Indiana, and the private and public actions taken to promote, protect, and preserve the health of these people would constitute community health. So, according to these authors, when you talk about health status of people living in a specific area, then that can be identified as community health. Community health assesses the health requirements of a whole community and makes provision to meet its health need, to carry out research in community health, and to organize health education for all. Now, what is important in this approach is this, that when you identify a community, you identify the entire community, and you are not talking about people selectively or groups of people selectively, right? So, very often we mentioned the word population. When we were talking about social medicine, we also use the word population, but there is no binding that we take into consideration the entire population. However, in community health, there is a consideration that we need to take into consideration the entire community. So if we take into consideration the entire community, then there can be several types of heterogeneity within that, or several types of basically inequality might be existing within that. So this is giving you a broader view about the prevalence of health in that context. Community health assesses the health requirements of a whole community and makes provisions to meet its health needs, to carry out research in community health, and to organize health education for all. Right? That means when a particular government is intending to take some kind of health initiatives or certain health programs, then the government need to know the kind of health outcome which is existing in that particular context. And so this community health concept is becoming important. The Euro Symposium in 1966 defined community health as including all the personal and environmental services in any human community, irrespective of such services were public or private ones. Here, basically, the focus is on the personal and the environmental services. That means the scope has been widened a little further, right? So, this way we can understand community health. Then we will talk about community medicine. This is again very important. Now, as you can see, earlier we talked about community health, and now we are talking about community medicine. Definitely, this is little different from the previous term. According to Paul, the report on Royal Commission on Medical Education 1968 for the first time uses the term community medicine instead of social medicine. So now community medicine, the use of the term community medicine is suggesting a kind of shift or uh, a kind of departure of the earlier term social medicine and its replacement by the term community medicine, and defined it in terms which embraced social medicine but went beyond it. According to Park, the report on Royal Commission on Medical Education 1968 for the first time uses the term community medicine instead of social medicine. That means we can see the departure of the term social medicine and beginning of the use of a new term which is community medicine, and define it in terms which embarrassed social medicine but went beyond it by giving greater emphasis to the organizational and administrative aspects than the academic and social medicine in the past. According to Park, the report on Royal Commission on Medical Education 1968 for the first time uses the term community medicine instead of social medicine and define it in terms which embarrassed social medicine but went beyond it by giving greater emphasis to the organizational and administrative aspects than the academic social medicine in the past. Now, what is stated here is this, that three things happened. One, there was a new term being used for the word social medicine, and that new term was community medicine. That means community medicine is being used for the term social medicine, and that has created some kind of embarrassment for social medicine. But there was focus on new dimensions, and those new dimensions were basically related to the organizational and administrative aspects. That means there was a kind of shift of focus from social medicine to community medicine, and in this community medicine there is new kind of focus on the organizational and administrative aspects, right? And not only focus on academic aspects as was there in the concept of social medicine. This gave a blow to the further development of social medicine, which had tended in many countries to be displaced by the newer term community medicine. That means something happened within the larger discourse of this biomedicine, and there is a kind of shift from the use of the term social medicine to a new concept like community medicine, because making use of the term community was appearing to be more relevant in the larger context. Community medicine is largely seen different from individual or family level medicine, which are largely clinical in their approach. Now, we need to understand this community medicine also, and here, although the application of clinical approach is there, but the focus is not on individual or family, but the focus is on the health issues of the community. So as we discussed in the concept of community health, and so this is similar in its approach when we talk about community medicine. But here the important thing is this, that the focus is shifting from the individual to the community. Community medicine is management of clinical medicine at community or society level. Very often, it may also include preventive medicine. Now, another important aspect here is this, that it is making use of clinical medicine, but not at the level of the clinics or the hospitals as these were earlier used, but the new location is closer to the community. For example, we talked about a rural community or urban community. So if the rural people are not having good health outcome, then this community medicine perspective talks about going closer to the community and then serving the community at that place so that it can become more accessible. So there is primarily a change in the approach of that system of medicine, right? It aims to protect and promote the health and well-being of communities and population through primary healthcare approach. Now, earlier we talked about primary healthcare approach also. In 1978, during the Alma Ata Declaration, basically the concept of primary healthcare was talked about, and primary healthcare was considered as a very comprehensive concept of healthcare, and which was not remaining confined to clinical intervention, but it goes beyond that, right? So this concept of community medicine is taking into consideration the approach of the primary health care, and that is why it is going closer to the community. Training in community medicine aims at nurturing primary healthcare professionals and physicians who can recognize and manage common ailments and health problems in the community, near their doorsteps, and in their community environmental milieu. Now, two or three things we can talk about here. Uh, when we talk about mortalities, then we get to know that infant mortality, child mortality are very serious types of challenges. Very often, maternal mortality is also a very serious challenge. And when you look at the rural and urban population, then we happen to find that the prevalence of these premature mortalities or some types of morbidities is more in the rural areas than in the urban areas. However, the health centers are primarily concentrated in the urban areas. So there is a kind of shift in the positioning of the health centers, and this community medicine or community health is actually talking about some kind of relocation of the centers of healthcare, and it is basically argued, or an advocacy is made, that these centers should go closer to the community, and that is why this community medicine name is coming. In most of the medical colleges as of now, in India also, there is one specific department which is known as community health department or community medicine department. Now, these departments are performing several jobs, and one very important job is to collaborate with the district hospital in planning and implementation of several national health programs like the disease control program, or like the nutrition promotion program, etc. So depending upon what kind of program the government is having, but these departments do collaborate so that they can reach to the communities, right? So this is how community medicine is operating, and this is how it is different from social medicine. Then we come to third important concept, which is preventive medicine. We have talked about this notion earlier also, and we have a fair idea that preventive medicine talks about prevention of occurrence of the disease or illness, right? So instead of focusing on the curative aspect, it goes one step forward, and it believes that there can be ways and mechanisms by which the occurrence of the disease could be controlled or prevented. And so this is known as preventive medicine. By definition, preventive medicine is applied to health of persons in groups, that is, it focuses on population rather than individual. Again, this is focusing on the population, because if we are talking about communicable disease, and basically that is related to communicable disease, then if we have controlled the disease in a larger segment of the population, and if unfortunately even a small proportion of people remaining affected by this, then because of the communicable nature of the problem will spread among the rest of the population. That means if we want to eradicate a communicable disease, then the entire population basically should be taken into consideration, and that is why that larger population and community approach is there, when we talk about prevention or preventive medicine. Primary objective of preventive medicine is the prevention of disease and promotion of health. Preventive medicines have helped us in decreasing the rate of morbidity and mortality caused from diphtheria, tetanus, typhoid, fever, and other diseases. And basically, we all are aware of the kind of vaccinations that we used to get, right? And those vaccines are primarily for prevention, right? And even during COVID, we all witnessed that people got vaccinated, and those vaccines basically were supposed to give some kind of immunity from the specific virus, in this case basically the COVID one. And further, preventive medicine is playing very important role in tackling the issues related to malnutrition, because nutrition is something that is very essential for the human bodies, and if a particular person is deficient in terms of certain nutrition, then it is most likely that it will create some kind of problem. So the preventive medicine approach helps us to provide a specific dose of that nutrition to the susceptible people, right? And if the vulnerable section of the population is getting the enough supplement of the needed nutrition, then their susceptibility to the specific disease would decrease or may come to an end. And so this preventive medicine is very important to minimize all types of disease which are caused because of the nutritional deficiency. And in India, we know how important these approaches are for controlling the disease caused because of deficiency of certain vitamins. We are all familiar that how basically iodine is supplied or added in the common salt so that we can get the required amount of iodine in our food. Discovery of vitamins, minerals, proteins, and other nutritional requirements of a healthy body has prevented the attack of many diseases. And so, this preventive medicine is very helpful in creating a kind of balance in the health of the individual, not only at the level of the individual, but at the level of the society or even community. Now, there are certain or specific specialty areas in preventive medicine. I have included few, but there can be many others. Basically, in different countries, the discourses of preventive medicine vary because disease is contextual and cultural, and so the approaches are also contextual and cultural. I have included few concepts so that we can understand the spread or the dimensions related to this. For example, public health and general preventive medicine. In certain hospitals or in certain countries, this specialization is existing. Public health and general preventive medicine focus on promoting health and preventing disease in individuals and communities. Practitioners in this specialty combine skills and experiences in clinical care. I've highlighted the word clinical care because we should get an idea that we are talking about the clinical care but in a preventive mode. And public health. Public health we also talked about earlier, right? So there is a kind of combination between this clinical care and public health to support the transformation of health systems and rebuild them based on the prevention of disease, injury, and death. That means all possible causative factors basically they are talking about. Practitioners work in a variety of sectors, including the corporations, primary care, public health department, government agencies, and other settings. So this is one specific approach to promote preventive medicine. There is another approach basically which is identified as occupational medicine. So occupational medicine is basically an approach to take care of the health needs of people in specific occupations, right? And we know that in certain occupations, people get exposed to a specific kind of environment or a specific kind of disease causation or disease causing factors. So this approach helps in addressing the problems emerging there. Well, occupational health in itself is a broader theme, and we'll talk about this in a larger context because in India, we need to talk about this problem at a larger level, taking into consideration the kind of regional variation and socioeconomic and environmental variations also, right? So we'll talk about this concept later also. And then aerospace medicine, we all are familiar with the specific kind of environment which people are exposed to when they are there in the airplanes or space vehicles, right? So this is a specific speciality which talks about the specific context which is related to the health, safety, and performance of crew members and passengers of air and space vehicles. So a specific situation. Now, what one thing is very important here, that sometimes there can be extreme environments in these situations, and sometimes there can be unpredictable situations in these circumstances, right? So there is a specialty branch which is talking about this type of preventive medicine, and this is known as aerospace medicine. And I have taken basically this concept from some of the existing research papers, and I have mentioned the websites of those the links of those websites in the slides itself. So anybody interested in understanding these things more can go to those websites and find the detailed information there. So now we can close this session, and as usual, we have a think about this problem. Why community medicine is identified as community medicine? How is this related to the concept of community? As a student of sociology, think about this. And then an activity question: is preventive medicine relevant for the prevention of non-communicable disease also? Often we talk about preventive medicine in the context of communicable disease. But the question is this: is preventive medicine relevant for the prevention of non-communicable disease also? Talk to some of the practitioners of medicine and write. So do this, and here are the references and recommended readings. So thank you very much. Hope to see you in the next lecture. Till then, take care.